Welcome back to our channel. Today we're going to talk about an important topic that affects many people worldwide, fatty liver disease, also known as hepatic steatosis. This condition has become much more common in recent years. While it was rare in the 90s, it's now something that even affects children. In the United States, more than 30% of adults over the age of 35 have this condition. Fatty liver disease isn't something you should ignore. It can lead to serious problems like liver scarring, cirrhosis, and even liver cancer. It's actually one of the main reasons people need liver transplants globally. The good news is that the liver can heal itself to some extent, so catching the disease early is really important. Recognizing the signs and symptoms can help stop the disease from getting worse, and in some cases, you can even reverse it. In this video, we won't just talk about the symptoms. We'll also discuss a common food that can cause fat buildup in the liver. If you have fatty liver or think you might, there's one type of food you should avoid completely. We'll also share some natural remedies that could be more helpful than you might think, and you might already have them in your kitchen. So, let's dive in and find out how you can protect your liver and improve your health. Causes and risk factors. 1. High blood pressure. High blood pressure or hypertension significantly increases the risk of developing hepatic steatosis, commonly known as fatty liver disease. This relationship exists because hypertension is often associated with other metabolic risk factors such as obesity and insulin resistance, which can exacerbate liver damage. Hypertension contributes to fatty liver disease through several mechanisms. First, it can lead to increased levels of circulating free fatty acids in the bloodstream. These fatty acids can accumulate in the liver, leading to fat storage within liver cells. Over time, this accumulation can disrupt normal liver functions, such as glucose metabolism and detoxification processes. Additionally, hypertension is frequently part of a cluster of conditions known as metabolic syndrome, which includes abdominal obesity, high blood sugar, and abnormal cholesterol levels. The combination of these conditions further increases the likelihood of developing hepatic steatosis. For instance, insulin resistance, a common feature of metabolic syndrome, reduces the liver's ability to break down and store fat properly, leading to fat accumulation in the liver. Furthermore, the high pressure in blood vessels associated with hypertension can cause oxidative stress and inflammation in liver tissues. This inflammation can damage liver cells and promote the development of fibrosis, a process where scar tissue forms in the liver. If left unchecked, this can progress to more severe liver conditions, including cirrhosis and liver 2, obesity. Obesity significantly increases the risk of developing hepatic steatosis, also known as fatty liver disease. This condition involves the accumulation of excess fat in the liver cells, impairing normal liver functions. The excessive fat can trigger inflammation, a stage known as steatohepatitis. This inflammation can damage liver tissue, leading to the formation of fibrous scar tissue, a condition called fibrosis. As the fibrosis progresses, it can evolve into cirrhosis, a severe form of liver damage where extensive scarring replaces healthy liver tissue. Cirrhosis severely compromises liver function and can lead to life-threatening conditions such as liver failure, liver cancer, and other complications like esophageal varices and hepatic encephalopathy. It is estimated that a significant proportion of individuals with obesity will develop non-alcoholic fatty liver disease, NAFLD, with many progressing to non-alcoholic steatohepatitis, NASH, the more severe form of the disease. 3. Sedentary lifestyle, characterized by a lack of physical activity, significantly increases the risk of developing hepatic steatosis, commonly known as fatty liver disease. Physical inactivity contributes to the accumulation of fat in the body, including the liver, in several ways. Firstly, a sedentary lifestyle often leads to weight gain and obesity, which are major risk factors for hepatic steatosis. When individuals do not engage in regular physical activity, they are more likely to consume more calories than they burn, leading to excess body fat. This excess fat can accumulate in the liver, disrupting normal liver functions such as detoxification and fat metabolism. The liver then stores more fat, resulting in fatty liver disease. Secondly, physical inactivity is closely associated with insulin resistance, a condition where the body's cells do not respond properly to insulin. Insulin resistance can cause an increase in blood sugar and insulin levels, promoting the storage of fat in the liver. The liver's role in managing glucose and lipid levels is compromised, leading to further fat accumulation. Moreover, a lack of physical activity can lead to a reduction in muscle mass and overall metabolic rate. Lower muscle mass and metabolism can decrease the body's ability to burn fat, making it easier for fat to accumulate in the liver. This situation is exacerbated by the presence of other metabolic risk factors commonly associated with a sedentary lifestyle, such as high blood pressure and dyslipidemia, abnormal levels of cholesterol and triglycerides in the blood. 4. Type 2. Diabetes. Individuals with type 2 diabetes are at a significantly higher risk of developing hepatic steatosis, commonly known as fatty liver disease. This heightened risk is primarily due to insulin resistance, a key feature of type 2 diabetes. Insulin resistance occurs when the body's cells do not respond properly to insulin, a hormone that helps regulate blood sugar levels. As a result, the pancreas produces more insulin to compensate, leading to high insulin levels in the blood. This condition affects liver function in several ways. First, it promotes the storage of fat in liver cells, as insulin also plays a role in fat metabolism. When insulin levels are elevated and cells are resistant, the liver begins to store more fat, leading to hepatic steatosis. This accumulation of fat can disrupt normal liver functions such as detoxification, protein synthesis, and bile production. Furthermore, the excess fat in the liver can cause inflammation, a condition known as steatohepatitis. This inflammation can damage liver cells and tissues, potentially leading to fibrosis, where scar tissue forms in the liver. Over time, if this inflammation and fibrosis are not managed, they can progress to more severe liver diseases, including cirrhosis, liver failure, and even liver cancer. 5. Excessive alcohol consumption. Excessive alcohol consumption is a major risk factor for hepatic steatosis, commonly known as fatty liver disease. The liver is the primary organ responsible for metabolizing alcohol, which involves breaking down alcohol into acetaldehyde, a toxic substance. This process generates reactive oxygen species, ROS, leading to oxidative stress. Oxidative stress damages liver cells and promotes inflammation, contributing to liver cell injury and the accumulation of fat in liver cells, a condition known as steatosis. When alcohol is consumed in large amounts, the liver prioritizes metabolizing alcohol over other metabolic processes, including fat metabolism. This diversion causes an accumulation of fatty acids in the liver, as the liver's ability to oxidize fatty acids is reduced. Additionally, alcohol interferes with the liver's ability to release fat into the bloodstream in the form of very low-density lipoprotein, VLDL, further contributing to fat buildup in liver cells. The chronic presence of fat in the liver due to excessive alcohol intake can impair liver functions such as detoxification, protein synthesis, and bile production. Over time, the continued consumption of alcohol can lead to more severe conditions, including alcoholic hepatitis, characterized by liver inflammation. If the inflammation persists, it can progress to fibrosis, where scar tissue forms in the liver. Extensive fibrosis can develop into cirrhosis, a severe and irreversible condition where normal liver tissue is replaced by scar tissue, significantly impairing liver function. Cirrhosis can lead to liver failure, where the liver loses its ability to perform vital functions, and it increases the risk of liver cancer. Other causes include the use of medications like amiodarone, diltiazem, tamoxifen, corticosteroids, and others. Initial symptoms of fatty liver. 1. Loss of appetite. Loss of appetite in people with fatty liver can result from metabolic changes, liver inflammation, hormonal imbalance, symptoms like nausea, abdominal discomfort, and psychological impacts. These factors, linked to the impaired functioning of the liver, affect the regulation of hunger and the feeling of well-being, emphasizing the need for medical follow-up for proper treatment and management of this condition. 2. Excess gas. People with hepatic steatosis often have an excessive accumulation of gases. Radiologists note that the presence of fat in the liver can lead to this problem, which even hinders the visualization of the pancreas in exams. This excess gas is probably caused by changes in the intestinal flora, directly impacting liver health. 3. Stomach pain and heartburn. A study revealed that people with hepatic steatosis often experience dyspeptic symptoms like heartburn, burning that extends from the chest to the throat, belching, and a feeling of a full stomach more than individuals without this condition, with a significant difference of 25% against 12.4%. 4. Pain in the right side of the abdomen. It's a discomfort in the upper right quadrant or a light weight where the liver is located, a nagging pain under the rib, probably because the liver has grown in size, which can also press the phrenic nerve causing pain around the right shoulder. 5. Fatigue. The liver, an essential organ, performs crucial functions such as metabolizing nutrients and generating energy. However, the presence of fat in this organ can seriously compromise these functions. Moreover, steatohepatitis, a condition where liver inflammation occurs along with the accumulation of fat, can intensify the feeling of tiredness. This liver dysfunction also affects hormone production, directly impacting mood, sleep, and overall body energy, leading to a persistent state of fatigue. 6. Nausea. Nausea in cases of fatty liver or hepatic steatosis arises for various reasons linked to impaired liver function. Firstly, the liver's ability to filter toxins is reduced, leading to the accumulation of these substances in the blood, causing nausea. Furthermore, excessive fat in the liver can result in liver inflammation, which brings abdominal discomfort or pain accompanied by nausea. Another factor is the influence of liver dysfunction on digestion, especially in the production of bile necessary for the digestion of fats. Finally, the enlargement of the liver can press on the stomach and other organs, generating a sensation of fullness and nausea. These symptoms reflect a liver functioning inadequately. These 6 symptoms suggest initial hepatic steatosis. Advanced symptoms of fatty liver. 1. Night blindness. Night blindness or nyctalopia can occur due to liver problems resulting from poor absorption of vitamin A, essential for eye health. The liver plays a crucial role in storing and metabolizing vitamin A. In conditions of liver disease, such as cirrhosis or hepatic steatosis, the liver's ability to store and release vitamin A is compromised. This leads to a deficiency of this vitamin, which is vital for the production of pigments in the retina necessary for vision in low light conditions. Without adequate amounts of vitamin A, the ability to see in dark environments is significantly reduced, resulting in night blindness. 2. Red spots all over the body. When the liver fails to produce essential proteins for blood clotting, there can be a decrease in platelets, known as thrombocytopenia, and problems in the absorption of fat-soluble vitamins. This failure includes vitamin K deficiency, vital for clotting. As a result, it's common for red spots to appear on the skin, a warning sign for these hepatic problems related to clotting and the absorption of essential nutrients. 3. Itching all over the body. In cases where liver disease is in an advanced stage and the liver is affected, there is an accumulation of bile salts in the blood. These salts can deposit on the skin, resulting in intense itching. This itching is more common on the palms of the hands, but can spread all over the body, causing discomfort. 4. Gynecomastia. Speaking of hormonal imbalance, gynecomastia, characterized by the enlargement of breast tissue in men, can be an indirect consequence of hepatic steatosis, a condition where there is an excessive accumulation of fat in the liver. This accumulation can interfere with hormonal balance, especially the relationship between estrogen and testosterone, leading to the development of feminine characteristics like gynecomastia. Commonly linked to factors like obesity, excessive alcohol use, and diabetes, hepatic steatosis impairs the liver's ability to metabolize hormones properly. Therefore, gynecomastia in this context reflects broader metabolic and hormonal imbalances associated with liver health. 5. Pale stools. In hepatic steatosis, the liver doesn't properly process bile salts, which are essential for coloring the stools. Without them, stools lose their characteristic color, becoming paler. This reflects the liver's difficulty in performing its normal functions. 6. Dark urine. In hepatic steatosis, urine darkens because the affected liver releases more bilirubin into the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color similar to cola. 7. Spider veins. When the body faces a hormonal imbalance, there can be an increase in estrogen, which is not adequately processed. This excess estrogen leads to the expansion of blood vessels, indicating a problem in the hormonal balance affecting blood circulation. 8. Jaundice. Jaundice occurs due to the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver processes bilirubin, but if there is liver dysfunction, bile duct obstruction, or an increase in the destruction of red blood cells, bilirubin accumulates, tinting the skin and eyes yellow. It's an important sign of various medical conditions. 9. Palmar erythema. Palmar erythema occurs due to the dilation of blood vessels in the palms of the hands. This characteristic redness can be a reflection of various conditions, including hormonal changes, or liver problems like hepatic steatosis. In the context of liver diseases, the damaged liver may not properly metabolize hormones, leading to a hormonal imbalance that causes the dilation of blood vessels. Additionally, substances that would normally be filtered by the liver can accumulate in the blood and affect circulation in the palmar area. This sign is therefore an indicator that there may be an underlying condition affecting liver health. 10. White nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail color occurs due to changes in blood composition and circulation, often associated with liver diseases. The sick liver may not be able to process and efficiently eliminate toxins from the body. This accumulation of toxins can affect various systems, including the blood circulation under the nails. Additionally, liver problems can lead to nutritional deficiencies, such as a lack of proteins and vitamins, which are essential for nail health, resulting in pale or white nails. This happens when most of the nail of the hand or foot appears white, somewhat dull. Almost the entire nail looks faded, except for a thin brown or pink band at the tip. Usually it appears on several nails. 11. Swelling in the legs and ankles. Swelling in the legs and ankles in cases of liver diseases like cirrhosis occurs due to an imbalance in the production and release of proteins by the affected liver. Normally, the liver produces albumin, a protein that helps keep fluid inside the blood vessels. When the liver is sick, the production of albumin decreases, leading to fluid leakage from the blood vessels into the surrounding space, causing edema. Moreover, liver diseases can cause portal hypertension, an increase in pressure in the portal vein, which can worsen the accumulation of fluid in lower tissues like the legs and ankles. If it progresses further, it can cause esophageal varices, potentially resulting in significant bleeding, mental confusion, weight loss, diarrhea, ascites, and even death. That's why it's important to recognize the symptoms and seek medical attention. Diagnosis and treatment. If you don't have any symptoms but have risk factors for hepatic steatosis, how can you find out if you have fatty liver? When detected early, hepatic steatosis can be completely reversed, protecting the liver from damage. Even in the presence of scars and fibrosis, it's possible to prevent the progression to more serious problems like cirrhosis and liver cancer. The diagnosis usually occurs through imaging tests like ultrasound, Connecticut scan, or MRI. It's normal to have a small amount of fat in the liver, but when it exceeds 5% of its weight, the doctor notices changes in the images, indicating a liver with excessive fat. There are 3 degrees of hepatic steatosis: Grade 1, mild steatosis; Grade 2, moderate steatosis; and Grade 3, severe steatosis, when there is a large accumulation of fat in the liver. Foods to avoid if you have fatty liver 1. Foods containing fructose. It's important to note that fresh fruits are not included here. The biggest culprit causing fatty liver is corn syrup and fructose, which are found in sodas, cereal bars, boxed juices. Tomato sauce, ketchup, mustard, and jellies. 2. Sugar. To maintain liver health, it's essential to reduce sugar consumption, including fructose. Sugar significantly contributes to the accumulation of fat in the liver, raising the risk of developing hepatic steatosis, a condition that negatively affects liver function. 3. Ultra-processed foods. Avoiding ultra-processed foods is essential to prevent fatty liver, as they contain high levels of sugars, saturated fats, and additives that can increase the risk of hepatic steatosis. 4. Refined wheat. Breads, pasta, crackers, and other foods made from refined wheat can increase fat in the liver. Avoiding refined wheat helps prevent fatty liver, as it can rapidly elevate blood sugar levels, contributing to insulin resistance and the accumulation of liver fat. 5. Vegetable oils. Today's diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It's advisable to avoid vegetable oils, as many are rich in omega-6 fats, which in excess can promote inflammation and contribute to the accumulation of fat in the liver. Foods to include in your diet to cleanse the fatty liver. 1. Fruits. Research indicates that fruits, especially avocado, are effective in reducing liver fat. Avocado stands out due to its high content of glutathione, a powerful antioxidant. This component not only fights fat in the liver, but also promotes broader liver health. 2. Whole grains. Oat bran, flaxseed, and chia seeds are rich in fiber and omega-3 and are associated with a reduced risk of hepatic steatosis. 3. Cruciferous vegetables. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk, thanks to its sulfur derivative. 4. Olive oil. Consuming 3 to 4 tablespoons of olive oil daily can significantly reduce fat accumulation in the liver, promoting an improvement in liver health. 5. Turmeric. Known for its anti-inflammatory properties, turmeric should be consumed with a pinch of black pepper to enhance its absorption and effectiveness in our body. 6. Coffee. Coffee, containing caffeine, tocopherol, vitamin E, and chlorogenic acid, acts as an antioxidant, reducing liver inflammation and offering protection against liver fibrosis. What to do to reverse the fat in your liver? 1. Exercise. Currently, fatty liver has become a common problem in children, partly due to changes in lifestyle. Previously, even with an inadequate diet, children remained active, for example, riding bicycles. Today, the preference for electronic games has replaced actual physical activities. To combat this, it's recommended to engage in walks or other moderate activities for at least 150 minutes per week. 2. Follow a healthy diet. The health of our liver is closely linked to our diet. Often, an inadequate diet is the reason for fat accumulation in this organ. Fortunately, a balanced diet can be the key to reversing this condition. 3. Avoid alcohol. Reducing or avoiding alcohol consumption is essential to protect the liver. Alcohol damages liver cells, known as hepatocytes, and can lead to the accumulation of fat in the organ, compromising its function and health. 4. Lose weight. By losing 5% of your weight, you can achieve significant benefits for your liver health, including reducing inflammation, fibrosis reduction, and decreasing hepatic fat, thus improving your overall health. Understanding the symptoms of fatty liver disease and recognizing the associated risk factors are key for early detection and prevention. Making lifestyle changes, such as adopting a healthy diet, engaging in regular exercise, and avoiding harmful substances like alcohol, can help manage and even reverse fatty liver disease. If you suspect you have any symptoms or risk factors, it's crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Taking care of your liver is vital for your overall health, so don't wait. Take proactive steps now to protect against serious liver conditions. Remember, your actions today can help ensure a healthier tomorrow. Thank you for watching, and we hope you found this information helpful. Please like, share, and subscribe to our channel for more health tips. See you in the next video.